I'm Michael McDonald.
Michael is a returning guest of the Bonati Spine Institute. 10 years ago, he underwent the first of his recommended surgeries. Now he's back to address a different level in his lumbar spine.
I served 30 years. I was in the Army Rangers. I was in the airborne trooper, jumped out of airplanes, that kind of thing. Jumped out, landed on land, landed in water, landed wherever, we could land. Our packs, our backpacks, our rucksacks, they were easily 75 pounds. And those are things that we would carry 3-4 days a week for training, and then weeks at a time out in the field. CrossFit has been my thing for a long, long time. I found it, probably 15 years ago.
Back and sciatic pain started to affect Michael's daily life, including his ability to walk long distances, to exercise, and to perform his job as a highly trained soldier.
In 1994, when I was stationed down in Panama, Castro from Cuba had released a lot of people from prison, again, a second boat lift. This time the United States intercepted those people and they took them to Panama.
When these prisoners learned they were being sent back to Cuba, a riot broke out while Michael was working at the holding facility.
I was very badly beaten. When all that was done, I had a lot of problems. Pain was in my lower back, and what it felt like was like there was an iron bar between my hip bones. And it was impossible for me to bend forward or backwards. And I would have horrible sciatic down my left side. I lived a life, but it wasn't a great life. Yes, pain constantly, just all the time. I was basically living on 800 milligram Motrin. Well, I'd say at least 20 years. Maybe not quite that long, but pretty much. When you have that kind of pain in your daily life, you wind up managing that pain. And you spend most of your day managing the pain. Like, I know I can only walk this way. I have to take Motrin, at this time. And I can't really go out and do that, so I need to do this instead. It's all those accommodations you make for your behavior throughout the day. And then one day you just go, I'm not really living a life here. When you wake up and you live in chronic pain for years and years and years, and you think that there's no end in sight, that there's no way that you're getting better, that this is it, and you're 42 years old, 45 years old, and you think, I have another however long left, and every day is going to be like this, you start thinking bad things.
As his pain worsened, Michael went to the VA. They offered him physical therapy, and when that didn't help, they told him he needed a spinal fusion.
You never see the same doctor twice. Every time you go to the doctor, you have to start all over again, and they always want to start you with physical therapy, which I completely understand, but once you've done it 4 or 5 times, how much more is it really going to help you? They did want to do surgery on me. They wanted to, completely open up my back and go in there and fuse this and graft that and whatever else and, hardware that they wanted to put in me. And I'm just like, none of this jives with what I know about the body, about physiology, about exercise, about, anatomy. None of this really sounds right to me. So, whether I'm right or wrong at this point, I'm just going to live with it. So the military was ready to put me out. I was at the point, I was in pain so much that I was unable to perform the things that I needed to do in my job. And they were, in the process of what they call a medical board, what they wanted to do, and, medical retirement for me, so on and so forth. So I was really urgently looking for something to save my career.
That's when a friend told him about the Bonati Spine Institute, and he decided to call for an appointment.
I walked in there and it was just like, nothing like when you walk into a normal doctor's office. It was, people cared about me. They knew my name. They knew who I was. They knew why I was there. There was never any doubt for me after that first day that this was the place for me. When I came in to see for my initial, consultation, they sent me on site back for my, for all my pictures, for my X-rays and my MRI. Also, all my blood work was right on site. Everything is all one stop right there. He has a very professional clinic that is fully encompasses everything that you need right there, and you don't have to go anywhere for anything. The images were up at the main building before I walked back up there. In comes Dr. Bonati. Gosh, just the way he does things is so amazing. He puts the pictures up there and he's like, I'm gonna tell you where you hurt, and he's like, this is what's going on, this is where it is, and it was like, well, yes, that's exactly it. And he said, and this is what we're going to do. You have multiple areas where you have issues, but you can only feel this one because it's so drastic. So we're going to fix that one. He's like, but you're going to need to fix these others at some point. We're going to make this really, really small hole, and and then we're going to go in there. We're going to, we're going to fix it. And I was like, that's perfect. I really felt like the Bonati Spine Institute, everybody there, like I said, they really cared, and when you, when you're in that kind of pain for that many years, when you think you have no hope, and you walk into a place and there's hope, it makes you feel, it makes you feel really good.
Hearing the exclusive Bonati spine procedures never use hardware of any kind and are performed incrementally, Michael knew he found the right surgeon and scheduled his first procedure.
He was in there and he was doing the surgery, and I was awake for it. And, and I remember him, I could feel every once in a while him in my back, but nothing tragic. Once there's nothing pinching on it, yeah, the relief is pretty much instantaneous. If I had known how easy it was to get rid of this back pain, and to feel good again, I never would have lived all those years with it. I would have gone to see Dr. Bonati like way sooner.
Out of the excruciating pain that limited his ability to live and work, he decided to delay his next procedure. Now, 10 years later, a new pain started impacting his daily life. But this time, Michael knew exactly who to call for help. I
started to feel pain again, like he told me I was going to do. This one's a little different. This last one, it was a little higher up. L3, L4, I think, on the left side is where it was. This one was a little different because it wouldn't bend me over and lock me up and like I can't move. It was kind of like a starburst effect. When it would hit, it was like pain would radiate everywhere, like up my back, up the sides, down everywhere. But no sciatica on that one. But it was more and more often, and it was just getting more and more, again, I was just like, once again, I'm back here to this point where I'm managing my day again, right? Okay, it's time to make a phone call.
Due to the use of conscious IV sedation, thousands of patients like Michael know the source of their pain is gone while they are still on the operating table.
Do what hurts the tip. No pain?
Nope.
All right, man. You got it.
In the recovery room, I'm sitting there, and Dr. Bonati came out after he'd finished a couple other procedures. And he came over to shake my hand, and I just stood up. And I shook his hand instead of kind of, assisting myself to stand up. I was just able to stand up, and I remember that. And I told him that at the time. I was like, well, I haven't been able to do that in a while. I feel great. Day to day, I feel amazing.
At the Bonati Spine Institute, patients return to normal life without the need for uncomfortable braces or time-consuming physical therapy. Instead, they are recommended a simpler solution.
No back braces were, I wasn't asked to wear a back brace at all. What the doctor told me to do was to get up and walk. And that was something that really, when we initially first spoke, that really resonated inside of me, because I don't see how you have a surgery and then you just lay around and get better, And I understand recovery. I understand it very well from an athletic point of view. But getting up and movement, when he said, that's what I need you to do, I was like, yes, absolutely. Get up and walk every day. I can do that. I mean, it's a new lease on life, basically, for everything, everything that you want to do, to be a husband, to be a father, to be a man, to do the career that you've chosen. Yeah, he gave all that back to me.